All right, good afternoon, everybody. Here with Josh and Paul, and back is Dr. Albert Coe. I think you'll see why in a minute. The daily summary, 320 positive tests out of cases out of 13,000 tests reported. That's a 2.4% positivity rate. That's the highest positivity rate we've had since June. That reflects a positivity rate that has been trending up over the last month. It's worth remembering that a week ago we had a positivity rate one day of 0.7%. So one-day numbers you focus on, but you don't dwell on, except for the trend that we've seen. Hospitalizations continue to go up as well at 17. I think Josh told me we were at 7-day average. We were at 138 hospitalizations a week ago. Today it's 172. It's worth remembering that we are part of a region. So if our 7-day average on positivity is about 1.5%, I think Max told me that Massachusetts is at 3.6%. I talked to Gina Raimondo via text. They're spiking up as well. And New York is a little lower when you look at the state, a little higher when you look at what's going on in parts of New York City, which is spiking up and flaring up in certain clusters there. Talk a little bit about what that means in a minute. This next chart gives you just a little bit of perspective, again, on where we've been since March 25th. And you can see the positivity rate bouncing around. It's worth noting back in those early days, we were testing more just symptomatic people, so that maybe overstated the nature of what was happening, but you can still see overall our positivity rate has been going down until recently. And let's jump to the next slide. This next slide is, I think, of interest on a couple of fronts. It's hospital admissions and discharges. I think I pointed out that the number of people in our hospitals has been, going up quite a bit. We still have, we were at 2,000 back in those tough days in terms of COVID-related ICUs. Now we're at less than 200. So keep a little perspective. We were talking about flattening the curve. It's still relatively flat. This tells you a little bit what was going on in, June when we had lots of discharges going on. You see those blue lines down below. So that meant a number of people in hospitals were going down a lot at that point. That's flattened out a little bit over the last month or so, but we do see the number of people admitted to the hospitals related to COVID has been going up a little bit over a period of time. It's also worth remembering that while we still have a lot of capacity, we have been doing elective surgeries. So you do have more people in the hospital and more people even in the ICUs not related to COVID. So we have to keep a balance there. But right now, we still have really good capacity. I think probably 50% capacity in the ICUs. So I think we're still in very good shape there. But it's a number we were looking at in April and we continue to pay attention to. This next chart, I think, is indicative of a couple of things. These are the hospital trends. I think you can see in terms of the 32%, 27%, 22%. What does that mean? That means number of people in the ICUs, 32% of COVID-related had to go to the ICU. That's been going down to, I think that's about 20% on October 20th. Number of people ventilated, that's the blue one. Remember, we were scrambling for vents just 6 months ago. Again, you see the trend on that is going down. Less people need to be ventilated. Less people need to be in the ICU related to COVID. And that last chart is sad, the purple one. Those are number of fatalities related to those that are in the hospital. And you can see that number has gone down as well. One of the things that Dr. Coe will be able to talk about is some of the incredible changes we have in terms of therapies and eventually vaccines, some of which you saw reflected in, President Trump being able to get out of the hospital sooner, and the number of different therapies that were administered there, and what that means in terms of less time in the hospital beds, lower fatalities, and that does increase some of our capacity as well. This next chart before I open up to our guests, Max. The next one is interesting to me. I'd just like to give you a little bit of history before Dr. Coe gives us the science. There was a really excellent piece, I thought, in Hearst Papers by John Brunig. He called it During 1918 Pandemic, Connecticut Barbers Rebelled, Docs Blamed Hysteria, Masks Were Boiled. And I thought this was interesting just as a comparison. It's worth remembering that back in 1918, when the pandemic hit, which they called the Spanish flu, misnamed the Spanish flu, didn't have anything to do with Spain. And early on, it was the elderly people back in March, April that were afflicted. Things trended down a little bit. October, sadly, was the deadliest month back in 1918. I think it was close to 300,000 people lost their lives. This is not 1918, but I think some of the messages you heard from that were interesting. Back on October 1st, this is reflecting on what was going on in Fairfield County in 1918. They strongly recommend, one, walk to work or walk to school, being outside as best you can. Classrooms were outside. They were using tents. They said, please send your kids to class so we can monitor the symptoms. I thought that was very interesting. In particular, they made a very pointed call of no promiscuous spitting. That's something I think we've really got under control here in this state. On October 3rd was interesting. That was the day that they finally, having started earlier, they shut down the saloons in Boston, and that's when they shut down the soda fountains in Connecticut. I think they did vice versa as well. That was a symptom. They were getting serious. It was then that they finally said, you have to wear the mask. That was on October 5th of 1918. The barbers immediately rebelled. I think we've had some of that before back in 1918. They said, they miss up. I can't see through my glasses. Everybody is smoking. That's a problem we don't have as much right now. That's what happened. They had to start issuing some very strict mandates or executive orders back in 1918, according to this great piece by John. One of those mandates was no sneezing in church. That's something that I think would be a little tougher to enforce. Sooner rather than later, they did have to stop the church services, and they did close down the schools, and they had to be very careful what they did going forward. The other big difference I thought was interesting was we've had to work really hard on unemployment. We'll be talking about that again on Thursday. Back then, you were fined if you were unemployed. You were fined $100 if you were unemployed. You were called a slacker. Totally unfair. Back then, it's worth remembering, you had a war going on. And so the war and the soldiers kept the unemployment rate very low. We're in a very different situation today. So, with that, we're happy to take some questions. And Dr. Coe can talk a lot about, we just got out of our briefing with the White House Task Force, the number of things that have changed between April and where we are today. Remember, back in April, you had the Surgeon General telling us don't wear masks. We were talking about hydroxychloroquine. There was a lot of misinformation being transplanted. Today, we're in a very different place when it comes to remdesivir, when it comes to Regeneron, when it comes to the steroid treatments, and all things that, as you saw from those charts, keep you safer, less fatalities in the hospitals, and a quicker exit from the hospitals. And you saw some of that with the Trump cocktail that got the president out of the hospital relatively soon. So you may want to ask Dr. Coe about that. So other ways that we are ready for this October surprise, if you will. We've got the testing capacity up at 150,000, ready to ramp that up as needed. This is testing not just symptomatics, but asymptomatics, so we'll be able to track what's going on in terms of a community spread. Obviously, we have a stockpile of our PPE that we're ready to go, so we are ready for what's happening, but nothing can make us more ready than have each and every one of you take this, continue to take this seriously a little bit longer. Max?
NBC Connecticut. Hi, Governor. Matt Austin with NBC Connecticut. I guess when people do hear some of those numbers in terms of the increased positivity rate and also the continued increase in hospitalizations, how concerned should people be? And do you think this is the part of a second wave potentially?
Well, it's not totally unanticipated. You maybe remember that when we did the colleges and other reports, and you heard from Gottlieb and Zeke Emanuel, we always anticipated there'd be some sort of a flare-up again in October, November. That's why we had the colleges plan to get their schools back. So yeah, but it is concerning, and we're much better prepared than we were before. And Dr. Koch can maybe talk a little bit about how some of the therapies and remedies are very different than they were back then.
Yes, and before talking about the patients and how we're treating the patients and what advances we made, just to pick up that, when the governor had asked Indra Nooyi and myself to co-chair the Reopen Connecticut, I think one of our major concerns was how transmissible this disease is. This is a disease which is driven by person-to-person contact, and that was really behind the rationale behind kind of the slow reopening of the state. What we've been seeing, and that protected us throughout the summer, what we've seen is an increase, and this is very nice work done by Forrest Crawford, who is doing analyses in support of the Department of Public Health, is that we've seen an increase in social contact. And when we have increases in social contact, we're going to have more person-to-person events, face-to-face events, and we're going to also have more transmission. I think the big issue here is that why are we different now here in October than in March and April? Is that we still have much of the state is still having overall reduced rates of social contact. What we went through, in the first surge back in April and May, really, imprinted on our behavior, making people are much more careful about their social contacts. And that's actually protecting the state. So what we're seeing now with these increases that are concerning, but these are going to be brush fires. I expect them to be more brush fires than they are going to be wildfires. And that's actually, will enable us, hopefully to make much more effective and targeted public health responses. Now, on the medical side, there have been several advances which have been very important. One is really the increase in testing. We went from 400 tests a day back in the peak of the surge to now over 13,000 tests a day, and that's enabled us to detect people early in the course of illness, get the people who need to get hospitalized to come into the hospital early, and rather than treating the sickest of the sick, and this is kind of plays out in the slides that the governor had just shown us, is that we're seeing less sick or less ill people who don't need as much intensive care unit, admissions to the intensive care unit or mechanical ventilation. And on top of that, there have been several, as the governor has mentioned, there have been actually several breakthroughs, really important breakthroughs. There was a trial done in England, it was called the recovery trial, which showed that steroids for people who need oxygen, who are sick enough to require oxygen or ventilation, you can reduce mortality by 30% by using steroids. We also have new drugs. There's a drug, Remdesivir, which blocks the replication of the virus, which also has shown to decrease the length of illness. And as we've seen in the news more recently, there's been a large trial done by Regeneron in our neighboring state of New York, with a monoclonal antibody cocktail. The results of those trials aren't out, but some of the highlights of those results have come out in the press release, and they look quite promising in terms of decreasing the viral load. What we're worried about in this disease is really those people have high viral loads, and that virus is, large loads of virus is making people sicker and getting the severe complications. And this monoclonal antibody cocktail particularly may decrease it. So we have now better ways than we were back in March and April in treating our patients and making sure they get out of the hospital rather than dying in the hospital.
Thank you, Dr. Koh. Governor, switching gears just a little bit, because of the pandemic, Pratt & Whitney has announced some layoffs related to that today. What do you know about it? Have you been in contact with leaders there, and do you know the number of Connecticut workers that are affected?
I certainly talked to the CEO at Pratt. I think is going back a couple of weeks. I mean, most of the aggregate numbers you hear are worldwide numbers. Most of the folks on the floor, they've already made those changes. I think you're talking about more white-collar folks at this point. But let me check and see if anything's changed in the 2 weeks since I talked to the CEO.
Okay, thank you.
Channel 3 Eyewitness News.
Good afternoon, everyone. What is the current percentage of hospital beds that are being used for COVID-19 patients in Connecticut?
Josh, you may want to take that. I mean, the numbers right now, we peaked at 2,000 back in April, and now we're at 172. So it gives you a little idea of capacity. But Josh?
Yeah, it's about 2% of hospital beds in the state are being used right now by COVID-positive patients, 172 out of close to 8,000 beds in the state.
Thank you. And, we're seeing the positivity rate creep up. Is there a benchmark rate right now where we'll start scaling back the phases or start closing down businesses again?
We're talking about what possibilities there might be out there. Obviously, we look at a positivity rate, see how fast it's ramping up, when it gets north of, say, 5%. And in particular, looking at the overall community spread as reflected by the number of infections per 100,000. 10 was our first warning sign. And obviously, anything over 20, 25 is something that we'd have to take very seriously.
Thank you.
News 8.
Hi, Governor. There's been talk of, ventilators, and early on we couldn't get enough ventilators. There was a lot of worry about ventilators. Where do we stand with that? And maybe that's for Josh or Dr. Koh. Where are we with the? We didn't give them back. Do we still have them, or did we ship them out? And kind of just put people's mind at ease, because it's a little early to be talking about it, but still,
I
we've been
can
getting
give the
emails.
statistics,
What's going on?
Dr. Koh, I think it'd be great for him to comment on the clinical evolution of thinking on when ventilators are being used. But
Hello, Josh. You want me to step in?
Yeah, maybe some.
Yeah, I think. Yeah, no, I think the question is an important one, since ventilators are key to the care of our patients, especially the sick ones. But we've had the hospitals. We've learned a lot, back in March and April, and I think the hospitals and our healthcare systems really did a fantastic job. We never went into surge crisis. And not only didn't we go into surge crisis, we didn't go into the massive ventilator shortages that many other countries or other states have gone into. So at this point, actually, as Josh had mentioned, just a moment ago, 2% of our statewide beds are filled with COVID patients. Back at the peak, maybe 20, 30, 40% of our hospital beds were filled with COVID patients. So there are more than enough ventilators at this point to go around. And as I mentioned again, we're not going, before that, this next wave for us, it's not going to be, hopefully not going to be the wildfire that we, went through in March and April. And I think the citizens of Connecticut are doing a good job in maintaining social distancing. It's not perfect, and we're having these super spreader events. But, we're going to have more of the brush fires, like what we're seeing in Eastern Connecticut or in Danbury. And that helps us a lot in terms of making sure that we have enough ventilators, we have enough PPE, we have enough equipment, and also staff to take care of our population.
And we did not give away any of our ventilators. Max?
WTIC 1080 News. Fox 61.
good afternoon. My first question is for Dr. Koh. Dr. Koh, you've touched on this already, but I wanted to ask it from a different angle. With the test positivity rate going up, the number of hospitalizations going up, but the number of people winding up in the ICU going down and the number of people requiring ventilation going down, it seems to suggest that people are getting less sick. What do you attribute that to? Does it have anything to do with larger numbers of younger people being infected? Is somehow COVID-19, the illness, getting less severe, or is it all treatment? What do you attribute that change to?
Yeah, thank you for that question. So that gets at the heart of why we're in a better place now than we were, back in March and April. In March and April, we didn't have enough tests to go around to diagnose, everybody who had COVID. Right now, we're doing a much better job, and we're also doing a much better job in the younger age groups, children as well as young adults. If we take ourselves back to March and April, we really didn't know what this disease would do for children. We know children and young adults. We know now that there is they have risk. The risk is not negligible, but it is lower than it is for the elderly groups. So we're testing much more broadly. And we're testing much more across all the age groups now, and we're capturing the people who have COVID. And we're also then, bringing them into the hospital earlier. And so a lot of this has been driven by not necessarily that the disease has gotten less severe, but more of the fact that we're just capturing, a wider group of people who've gotten infected. And those people, as we know, the larger you cast that net, you're going to get the people who are less sick. And that's a good sign. And that's exactly what was the goals of the state in Reopen Connecticut back in April and May.
All right, Doctor, thank you. And Governor Lamont, just wanted to ask if you have been able to get any answers as to how or why potentially hundreds of unemployment recipients had their direct deposit information changed on their DOL accounts without their knowledge?
I can tell you that with the CARES Act and all the money that came out of the federal government over the last 6 months, there's been extraordinary cyber hacking around the country. I can tell you the DOL is tracking this very carefully as regards our own unemployment checks and identity theft. And right now, our number one recommendation is make sure you continue to upgrade your password, change your password, make sure that you do everything you can to keep your identity from being stolen. And we're doing everything we can at DOL and across state government as well. But we've talked to other governors about this, and the nature of the cyber hacking going on, the identity theft, is a problem that's just evolving now.
All right, Governor, thank you.
The Associated Press.
Thank you. Good afternoon, everyone. Governor, the nurses at Bacchus Hospital in Norwich started a 2-day strike today regarding ongoing contract disputes, and also they have concerns about availability of PPE. Are you going to try to intervene in any way, considering your close working relationship with Hartford Healthcare?
Yeah, with both Jeff and Jan, actually, a very good relationship there. First of all, put to rest, we have all the PPE that we need. That's not an issue. I'm doing everything I can to remind both parties how important it is we have Bacchus Hospital going. Out there they are in southeast Connecticut, right where the pandemic looks like it's probably flaring up a little bit, right in Norwich right now. I'm very hopeful that they're getting closer to the finish line and keep those conversations going. We don't want to wait another day.
But you've been in communication with them?
I have, as has Paul, yes.
And Dr. Koh, is the rate of infection in Connecticut and also the rate of infection nationally, is it where you thought it would be in October? Is it where it should be?
So the question about where it should be, obviously the goal of all our goals is to keep it as low as possible. But is this unexpected? And this isn't unexpected. We know that, as we are gradually opening as we open society, as we're having more contacts, that we are going to have high rates. are higher rates than what we suffered, or higher rates than we experienced over the summer. So this is not unexpected. The big question is, and I think there are two issues here. When we look at rates, whether they're in the state of Connecticut or whether we look at them nationally, these are averages, and they don't tell the full story. They don't tell this full story of, for example, I'm here in New Haven. In New Haven, our rates are pretty low, and there's quite a bit of social distancing, avoidance of large gatherings, use of face masks. We had outbreaks in Danbury. We're having an outbreak in Southeast Connecticut. And so when you take the average rate across the state, it really doesn't give you the picture of actually what's happening at this moment, and also, more importantly, what we should be doing about it. And as the DPH, I just want to make a special call out, the people at DPH, what they've done now, and for example, in terms of protecting the nursing homes in those hot spots, in coming out with alerts, to getting out, public health communications on face masks. That's really kind of the meat and potatoes of what a good and robust emergency response should be. And that's happening here now in all those regions that we're having these kind of brush fires.
And I just wanted also, could you kind of quantify between what you consider a brush fire and what you consider a, what was the other fire? that,
a wildfire.
Like, a wildfire, like numbers-wise, what does that mean?
Right, yeah. So when we think about an outbreak, a large outbreak, it determines, a lot of it is determined on, of course, the mortality, morbidity, but also, about what we can do, what actionable information that, what's the threshold that would give an actionable information. And, there's several thresholds out there. For example, there's the 25, the daily, case incidence of 25 per 100,000 is actually a pretty good one. If we take a look at states like North Dakota, South Dakota, Wisconsin, which are really, having a large resurgence, they're above that threshold. I think there's another threshold, and it's, here in Connecticut, we hold ourselves to a higher standard in terms of public health. And, what we're trying to do is to keep all of the, the community transmission below levels of what would be 5 and 10 per 100,000, or 5 to 10 new cases per day per 100,000 population. So in much of the state is actually in that situation. It's the places that I mentioned before. We had an outbreak in Danbury. The Commissioner Gifford called an alert, at the end of August, which was very effective in terms of controlling that outbreak. Similar alerts are being made now in Southeast Connecticut. So we can really have focused targeted interventions that don't have deleterious effects for the whole population of the state, but are actually targeted to the areas that most need it.
Okay, thank you very much.
Hearst, Connecticut Media.
Thanks, Max. Hi, Dr. Ko. We're approaching the 7th month anniversary of the first fatality on March 17th, I think it was. And in that first X hundred patients, maybe, compared to now, has the average patient changed? Are we, in the hospitals, are we at a particular age or comorbidities, or is that too general a question to ask?
No, I think that's an important question. And it tells us a little bit, the answer to that question tells a little bit about where we came from and what lessons we learned. And it also tells us about kind of the challenges that we have in the future. So those first 100 or 500 deaths that we had in the state, it really, which struck us, both healthcare professionals as well as the public servants throughout, it was really, how it affected our nursing home population, as well as our underserved communities. The disproportionate burden that it had among those. And it was a real, not only a wake-up call, but it was an important lesson learned. And I think based on that, and this was, this has started with the response by the Department of Public Health at the height of that epidemic in April. It was one of the central key touch points of the Reopen Connecticut. It went on to really, I think, a fantastic, effort made by the Department of Public Health to go from no testing in nursing homes up to about 10 to 13,000 tests a week of nursing home staff and nursing home residents. Really heroic effort made by the state. And we still are having breakthroughs. We know about the Three Rivers nursing home. We know that there are several other nursing home outbreaks, but for the most part, in this second resurgence that we're experiencing, much of the nursing homes are being protected, by testing, by training in infection prevention, in doing sound infection prevention, interventions such as cohorting. So that is something very different from what happened to us in the first month, the first 500 deaths in the state. I think what we need to do, and we have much more work ahead of us, is really taking care of our underserved communities, whether it's in Bridgeport, Hartford, New Haven, as well as in Norwich and in New London. And we know that, among our minorities, our Latino and African American community, that COVID, not only here in Connecticut, but throughout the country, has a disproportionate burden. And really the importance of public health education, offering testing, getting people diagnosed and getting them in the hospital so that they don't suffer the severe complications. That's really, we can't take the gas, the foot off the pedal on that. And that's, I know this is the primary priority of the Department of Public Health.
Could I ask you what your opinion, Dr. Ko, is on, for lack of a better description, the antics of the president after his infection and now his resuming his campaign?
Yeah, I think speaking as a healthcare professional, is very, very disappointed, and by the conduct. I think one thing is that we have as a tenant is we don't blame the patient. Okay, but I was really disappointed at the conduct of the physicians taking care of him. Many of them, he went to one of the best hospitals in our country, the best infectious disease doctors there. But I think the lack of clarity, and I think we have to separate the president as a patient and this event as a, that had elements beyond, the care of a patient. And I think what, the back and forth about the information, the use of the drugs and the indications, I think one of the things that, I'm particularly concerned about is the kind of the erosion of trust when miscommunication and lack of clarity and transparency play out, and that affects all of our ability as healthcare professionals to take care of our patients. If that trust is undermined or eroded, that's what I can, that's kind of my overall general, kind of thoughts on that. There, of course, the specifics about what medication he received and did he, were they warranted? I think the other issue, really, again, and this is coming more from the public health side rather than the medical side, is that, the potential risk that may have occurred by taking someone that we don't know about their status of their contagiousness and having them expose other people. We're certainly, with our patients, very firm about, protecting other people in the community through isolation, through quarantine. When we see that eroded, when we see the facts or the evidence behind those sound principles eroded, that's I guess another sense of concern for all of us.
Max?
Thanks. That was very polite. Thanks, Max.
The Hartford Current.
Hi. Governor, we're as a state getting kind of close to that 10 daily cases per 100,000 benchmark that we use to put other states onto the travel advisory. So I'm wondering what would happen if we hit the criteria for our own travel advisory.
I was thinking about that myself. Frankly, 36 states, I'm told, are on that travel advisory right now. So we have to sort of rethink it. I mean, right now it's certainly a vast majority of states, and it could be our neighboring states, just as Rhode Island has come on and off. I think overall the travel advisory has been very effective. It's reminded people from highly infected states, before you come to Connecticut, get tested. When you get here, quarantine. I think it's discouraged some unnecessary travel. But obviously this net is getting wider. We have to rethink it.
So you're saying it might kind of be obsolete at this point?
I wouldn't go that far. Right now, it applies to virtually everybody, and except for those of us here in the Northeast, and our numbers are ramping up. So let me revisit that. But I think it's been a really net positive for the state, just in terms of discouraging unnecessary travel when they do travel, quarantining and testing.
And then I also had a question for Dr. Koh that's a little bit related. Obviously, this has been very regional with different regions seeing upticks at different times. I'm just kind of wondering, what are the factors that would lead right now? The Northeast is seeing an uptick, but the West Coast still has low numbers. Florida has low numbers. Arizona has low numbers. The Midwest has high numbers. What different factors would be applying in one region but not another that would cause these kind of regional variances?
Yeah, and I think this is the important issue of. So there are several factors, but I think the one that's most important is really the public awareness. The key element or the key players in preventing COVID are going to be our fellow citizens, and their understanding, their awareness of face mask use and social distancing and minimizing large gatherings. We know what we've learned in the last 6 months is the importance of these super spreading events. And these super spreading events, the probability of them increase exponentially or increase when we have large gatherings. And so our ability to translate that or to inform, our population, of the importance. If there's anything that we've learned in the last 6 months, is really that we can control it, but we have to control it through, kind of these meat and potatoes, the face mask, social gathering, the social distancing, and reducing the large gatherings. So why are other states more protected than others? So states like Florida, and you can see they've gone through exactly what we tried to avoid, and which we did avoid, back when we were doing Reopen Connecticut. They got hit hard by a large epidemic. They started social distancing. There were some laws, and then they reopened again. And so now they're up on another upswing. Other states like Arizona learned the lesson the hard way. They had their large surge, and now they're socially distancing. And that behavioral effect, that indirect effect of the fear of the COVID, I think, which really goes back to what the governor was saying about 1918. We had that first wave in 1918 where there was a lot of mortality, a lot of morbidity. People kind of learned their lessons. We had a second wave, which was less. And it's really the behavior which we can do. We see now in the United States that we're having outbreaks in places that didn't experience COVID, and that's the Midwest, in parts of the West. These are places which did experience the outbreak, didn't have that behavioral imprinting, that protective effect, and then they're going off, on a surge.
The only thing I'd add to what Dr. Koh said, I was talking to Governor John Bel Edwards from Louisiana, a state that seems to have a target on its back when it comes to hurricanes and COVID. He just reminded me, this is the time of year when Louisianans start going outside because it's getting cooler, and this is the time of year where Connecticut people start heading inside because it's getting colder. I think that will impact two different regions as well.
Thank you.
The Connecticut Mirror.
Thanks, Max. Governor, I wanted to ask you about state finances. You know recently that the state university system is in a fiscal crisis. There's a big deficit at UConn. The hospitals and nursing homes got some federal relief funds, but they're saying that's just a fraction of what they've lost and what they're going to lose in FY21. And we still have a lot of nonprofits and municipalities struggling. When the legislature comes back in January, in addition to looking at your deficit mitigation plan, do you anticipate there's going to be some discussion about putting some additional money into the budget, some additional spending in some key areas for this fiscal year, not for the biennium to come?
Keith, I think we're going to learn a whole lot about what the federal government's going to do and not do over the next, 45 days. And I think that will certainly inform our thinking in terms of what we've got to do as a state. But you're right, I got to tell you, whether it's not-for-profits, whether it's churches, whether it's airlines, whether it's universities, across the board, there's a real need. I think we've got to do more when it comes to our small businesses and build on the PPP, especially for some of those businesses that haven't opened or really can't open to much capacity at this point, or people are shy about going back. We're going to look hard at the revenues we get from the feds in terms of testing, see whether that gives us any more flexibility to help out universities going forward. I think we may see some additional aid coming from the federal government sooner rather than later when it comes to hospitals. I think we'll have a lot of clarity on that in the next 30 days.
But, Governor, if for some reason the federal money is not there, are state dollars off the table as far as you're concerned?
No, nothing's off the table, but let's see where we are. And I think, look, the president says we're not doing enough. Nancy Pelosi says we've got to do more. The head of the Fed says we got to do more. Unfortunately, I got 3 weeks till an election, so nobody can do anything in Washington. But I think you're going to see a lot of clarity on this pretty soon.
Thank you.
Connecticut Public Media.
Good afternoon. Has contact tracing revealed any changes in spread? I know the last time you spoke, it was mostly small family gatherings.
Josh, you want to take that?
Yeah, that seems to continue to be a source of transmission. Gatherings where people are with their family members, coworkers, maybe in the lunchroom, other environments where you falsely assume that just because you know the person or you have a close relationship with them, it's okay to take off your mask, not socially distant, especially when you're indoors. And there continues to be a real theme along those lines, and that's the importance of everyone keeping their guard up. We continue to identify through contact tracing, some, other events, but really no common themes other than those small private gatherings that continue to be a problem.
And how has the reception to contact tracing changed? Are people more receptive to answering these phone calls now?
Anecdotally, we do hear that from both our state contact tracing team and local health districts. I think people are getting more aware of the importance of contact tracing and participating. I think we're getting better at it too, right? We're continuously improving our processes, finding different ways to ask the questions, bringing more resources to bear, more supports to people. So there's more value in the process for them potentially if they need help with housing or food to be able to self-quarantine if they've been in close contact with someone. So, we continue to make the process better, and I think people are becoming more open to participating as well.
The Waterbury Republican American.
Thanks. Just a couple quick questions. For a coworker, has the state secured adequate number of freezers to store the coming vaccine at minus 70 degrees Celsius, as it will be required? If not, what more must be done?
So that's one of the topics that our vaccine advisory group is looking at. We announced a full membership last Friday, an incredibly broad and diverse set of volunteers coming from academia, from medicine, from hospitals. And Dr. Koh, thank you again for your continued service there as always. But we're in dialogue with the hospitals. Our hospitals have extensive cold freezer capacity, and we'll look at what gaps may exist that we may need to fill in as part of that effort.
And Josh, what is our positive case rate out of 7-day rolling average per 100,000?
The positive test percentage is 1.5% over the last 7 days.
Uh-huh. But in terms of the travel advisory, that's what I was wondering. There was a question earlier.
Yeah, it's somewhere between 8 and 9 per 100,000 for the state.
Okay. Okay. And Dr. Ko, I just wanted to confirm, are you saying we are experiencing a second resurgence of COVID at this moment?
Well, I think this is part of this is semantics, but we're seeing an increase in cases. This is certainly very different from what we had experienced back in March and April, where this was a statewide phenomenon. What we're seeing is actually focal resurgences or focal surges in specific places, of the state, and not across the state, and certainly not at the numbers that we experienced when we got hit hard in March and April.
But what do the increasing positivity rate and these rising hospitalizations tell you at the moment?
Yeah, no, so it tells us that, certainly we have work to do in terms of, prevention. And, again, if this is, we're looking at average numbers across the state. But New London, the situation there is very different than it is in Bridgeport or Stamford or New Haven. What's happening in Hartford is different than what's happening in Waterbury. And really and I think I've used this expression before, but I really like the politician in my era that I admired a lot was Tip O'Neill. And he said that all politics is local. Well, it's the same with public health. There are things that the state can do, but really in terms of getting into the weeds, and that's what's going to make a difference. And that's what Danbury has been doing. That's what New London is doing right now, and Norwich is doing. Each of these places are very different, and the actions have to be tailored to the local environment.
Okay. And Governor, are you saying that the direct deposit changes in the unemployment benefits was a result of a cyber attack of hackers?
No, I don't think I was saying that, but I've certainly been talking to governors over the last few months, and I know that other New England states have been hit hard by cyber attacks in and around unemployment payments, trying to redirect that. Part of that is identity theft. DOL has kept a good track of that so far, and what we're trying to do is make sure everybody does everything they can to protect their identity in the meantime by adjusting their passwords.
Okay. And, we just got some numbers today, which I had somewhere on my screen. I can't find them. But there was roughly about 560,000 applications for absentee ballots have been processed into the centralized voter registration system. And I believe north of 163,000 have been returned. What's that sort of tell you about people's interest in voting and in taking advantage of the one-time opportunity to vote by absentee ballot?
Tells me that the people of Connecticut are really smart. We've made absentee balloting easier to do, so you don't have those long curling lines waiting around. I don't know what the positivity rate's going to be on November 3rd. I know of a certain age it's better not to do it, and I think people are taking advantage of it. We're going to do it safely, we're going to do it honestly, and we're going to get it done on time.
And what about the vote tally? It's going to take take a little longer to find out some results on election night. People are going to need to be patient.
Well, yes and no. I mean, I'm hoping that each of the town clerks are anticipating this. We've got additional volunteers. They've got additional money from the Secretary of State's office to provide people to help with the tallying. We're allowing them to start tallying the votes at 6 a.m. on Election Day. They don't have to wait till 8 o'clock at night. So, yeah, there's a lot more votes to tally, but I think hopefully they're going to be ready for it.
Okay, thank you very much.
CT News Junkie.
Hi, so I'm just wondering, so the increase in the positivity rate is being attributed to these small family gatherings. What is the state doing to, I guess, enforce this, enforce the COVID rules that it has on the books to prevent this type of infection spread?
I could start and then let smarter people take it, but you're right. As we heard from Dr. Birx, less likely in the classroom, less likely in the workplace, less likely in the restaurant, where people are a little more formal about managing the protocols. It's those informal interactions where we think there's the greatest risk right now. That said, really what I can best do is use the bully pulpit to urge people to be particularly careful now during this season leading up to Thanksgiving and how important that is. And Christine, I also keep, as always, looking at the region because we're not an island unto itself. I see what's going on in Providence and Boston and parts of Brooklyn and Queens, and we'll be managing that very closely. Anything else to add, guys?
Maybe I'll just add a very quick thing is that, so we know from actually, kind of impressive contact tracing studies done throughout the world, particularly in places like Korea or South Korea. And we know that within a family gathering, family household, roughly 10%, so not everybody who's in a family of somebody who's been infected, gets COVID. It's maybe about, it's only actually 10 to 15% of the people in a family gathering. I have a patient, I was just taking care of a patient, who was, had COVID, and no one in the family, got COVID, even though they were in the same household. And that kind of underscores what we really learned a lot about this epidemic is that it's these super spreading events. It's this rule that we say, and it's a rough rule, that 20% of the people are responsible for about 80% of the transmission. And because you have that variation of who is contagious or who can infect others, versus other people who are infected, what that really plays out is it's those large gatherings. It's when you get good, people huddling, whether it's at bars, whether it's at restaurants or any type of event where you have a lot of people, because that increases the probability that you'll encounter one of those people who are apt to be a super spreader. And so if there's anything takeaway message, and I think this plays out with a lot of the outbreaks that we've had here in the state, it's really when you have these larger gatherings. So I would just, go back to what Josh said. It's not necessarily the small family gathering, like the household, but it's actually the larger family gatherings or the barbecues, that are kind of fueling this epidemic with these super spreading events. The White House, the Rose Garden, is a good example of a super spreading event. You had a lot of people without masks, and the probability that one person there could spread to another was much higher than if you had a smaller gathering.
And I just also want to ask about the flu vaccine. In previous years, there hasn't been enough flu vaccine. Did they make enough flu vaccine this year?
You guys know that?
Well, I think the answer will depend on how many people sign up and take it. We know that we in Connecticut have a significantly increased supply this year versus prior years, and the DPH is working very hard to try to drive our percent uptake higher than we've ever done before. So time will tell, I guess, is the answer to your question.
Thank you.
All right, thank you, folks. Let me just say, when you see the positivity rate going from less than 1% to 1.5%, now 2.4. It's not unexpected, but it's incredibly unnerving and a little exhausting. Average is 1.5, still one of the lowest in the country. I want to keep a little bit of perspective there. I think you heard from Dr. Ko how much better prepared we are this time than last time in terms of therapies, in terms of the PPE need, in terms of the testing. I think that the people of Connecticut are a lot better prepared. I see it in Danbury. We talked about track and trace, and there we've been able to bend the curve from what was a very high infection rate. We brought in the cavalry, brought that infection rate down, cut it by more than half. What a difference that makes, thanks to Mayor Mark Boughton and his team. I was out in New London just, I think it was yesterday, and again, there were people waiting in line hours to get tested. And while we're exhausted and wish this was behind us, I think we also know what it takes to beat this virus and beat it for good. And I'm counting on the people of Connecticut to help us get through this, so I know we're going to be able to do it together. Thanks, everybody.